see here that you had an allergic reaction, is that right?
Yes.
So can you tell me a little bit more about it?
I went out to a restaurant a couple of days ago and I think I ate something. I'm experiencing watery eyes. My throat kind of feels a little weird, some redness and itchiness throughout my whole body. And I just want to see what's going on.
Okay. Did you notice any rashes when this happened?
Yeah, I want to say up on my upper chest, a little bit on my arms.
Okay. And when was this, you said? Last night?
Last night, yes.
Okay. And how are you feeling today? Did the symptoms go away?
They're still present a little bit, the redness, the itchiness.
Okay. Did you take any medication for it?
Other than just ibuprofen, not really.
Okay. Did that help at all?
Just a little bit, not really.
Yeah, ibuprofen's not really good for treating allergies, but I can give you a recommendation in case this happens next time. Okay. Do you have any idea what were the ingredients in what you ate?
I did have tacos, so it might have been the cilantro or maybe the spices in it. I'm not really sure.
Okay. And there's always the possibility of cross-contamination, so we'll do tests for some of the most common allergens.
Okay.
Okay, I'm going to ask you a few questions just to update this on my chart. Can you go ahead and confirm your date of birth for me?
Yes, November 7th, 1993.
Okay. Do you smoke?
No.
Have you ever smoked?
No.
Do you vape or have you ever vaped?
Occasionally.
Occasionally. Any recreational drug use?
Nothing.
No. Okay. Do you take any medication regularly?
No, no medical. No regular medication.
Do you have any known allergies?
I honestly think I might be allergic to cilantro. That's why I'm here.
But nothing that has been confirmed?
No, nothing confirmed.
Okay. We'll definitely be testing for that. Okay. Do you have any history of diabetes, high blood pressure, any chronic illnesses?
Diabetes does run in my family on my grandmother's side.
Is that your maternal or paternal?
Maternal.
So I'm going to start by taking your vital signs. First, I'm going to be taking your blood pressure. Okay, I'm going to slide this on your arm. Okay, you can go ahead and relax. Place this on your index finger right there. Nice, 7.9. Oxygen is 99%. Room air. Blood pressure. this away for a reading. Okay, that's 100/65 is normal. And 96 heart rate. Okay. Just gonna slide this out. Okay. I'm gonna be putting on my gloves and I'm gonna start palpating and examining your skin first. I'm gonna look for any leftover rashes, redness, irritation. Okay, you can just go ahead and relax right now. I'm gonna be taking a look at the skin. Okay, I notice a few spots under the chin. Okay, look towards me. Okay. Tiny bit of redness, not a lot left. And I don't really notice any inflammation. Okay, I'm gonna be palpating the lymph nodes. Starting with the preauricular lymph nodes. Don't notice any inflammation there. Postauricular normal swell. Submandibular. And submental normal. Gonna palpate down to the neck. And go ahead and swallow for me. Okay, I'm gonna be checking the skin on your arms. Okay, a little bit of redness, but it's diminishing. And plug normal. Okay, gonna relax this arm. Okay, it's not too bad. Probably the symptoms are already diminishing and going away. You can go ahead and open your eyes. Okay, so I'm going to be doing a swab just to make sure that none of these symptoms are due to a virus. So I'm just going to do a test and then send it to the lab. Okay, I'm going to be checking your scalp a little bit, make sure there's no irritation in there. Okay. You can just go ahead and relax for me. Did you feel any itchiness on your scalp at all?
I want to say a little bit yesterday, but it went away.
Okay. Kind of look towards me. Okay. Looks normal. I don't notice any redness or irritation, so that's good. Okay, I'm gonna be doing a few tests. I'm gonna be checking your eyes. Can you just go ahead and look straight ahead? Just checking your pupils. Okay, you can go ahead and look up. Go ahead and look down. Okay, see. Stay looking down for me. Okay, go ahead and look up. Okay, I don't notice any irritation on your eyes. I'm gonna do a quick vision test. Go ahead and hold that for me. You're gonna go ahead and cover your right eye with your right hand and extend the chart at arm's length. Does that look blurry at all?
No, not really.
Okay, can you go ahead and read this last row for me?
LTFPH.
Okay. Can you tell me what number is this?
Number 8.
And this one?
5.
You tell me what letter is this one?
J.
And this word right here?
Glasses.
Okay, perfect. Go ahead and switch sides. Extend it at arm's length. Does that look the same?
Yes, about the same.
Go ahead and read this row, but starting on the right.
Yes. HPFTL.
Oh, okay. Can you tell me what word is that one?
Visual.
Okay. What color is this?
Green.
This one?
Red.
What number is that one?
2.
What letter is this one?
J.
Perfect. Okay, vision is normal. Just gonna take a closer look at your eyes. Okay, I'm gonna have you look straight ahead. Okay, that looks normal. There's no redness or irritation. I'm gonna take a look at the other one. Okay. Okay, it's normal too. Okay, I'm gonna be checking your ears, make sure there's no irritation. Just go ahead and relax. Okay. Okay, the tympanic membrane looks okay. There's really no redness or inflammation. So I think the symptoms are probably clearing out by now. Okay. Yeah, everything's normal. Okay, I'm gonna go ahead and do a hearing test. You can actually keep your eyes closed. And I'm gonna be making a sound next to either the right, left, or it could even be both ears at the same time. And I just want you to tell me if you can hear it mostly on the right, left, or both.
Okay.
Did that sound right, left?
Right. Left.
Okay.
Right. 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 left, 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 both sides, both sides.
Okay, now can you tell me if this sound comes from up or down?
Up, down, up, down, up.
Okay. Now can you tell me if this sounds closer or this one?
The first one,
Okay, this one or this one?
the second one.
Okay, perfect. So that's all normal. I'm going to be taking a look at your mouth. Okay, you can go ahead and open. Okay, you can go ahead and say ah. Okay, very good. So the throat seems to be back to normal. I don't notice any irritation or inflammation either, so that is great. So I'm going to be putting some of these little paper strips on your tongue, and you can go ahead and taste it and let me know what it tastes like. You can close them up if you want to taste it. Does that taste like anything?
Nothing.
Nothing. Okay. Okay, we're gonna try this one
out. It's a little sour.
Sour. Okay.
Also sour.
Sour.
Sweet and sour.
Sweet and sour, both at the same time. Okay. That's interesting. Okay. Now we're gonna try a couple different smells. First, I'm gonna ask you to cover your right nostril for me and take a deep breath. Just want to make sure there are no obstructions. Okay. Other side. Okay, perfect. Go ahead and take a deep breath. Can you recognize that smell?
Cinnamon.
Okay.
Menthol.
Mm-hmm. Okay, now you're gonna go ahead and cover your right nostril for me. Okay, go ahead and take a deep breath.
I can't really smell that.
Do you not smell anything, or you
No,
cannot?
I literally don't.
Okay.
I don't smell it.
Okay, let's try this one. Let's cover the other nostril. Doesn't smell like anything, or do you kind of just not?
Oh, it's plastic. A little. I can't get it.
Okay. But you do smell it. You
Yes,
just cannot
yes,
pinpoint what it is.
Yes.
Okay. Okay. I do want to do one more on your left nostril, which was the one that you couldn't smell. Okay. Go ahead and cover your right nostril. Okay. Go ahead and take a deep breath.
Minty.
Minty. Okay. But you can definitely smell.
Yes.
Okay, perfect. Okay. Okay, now I'm going to be checking your facial sensations. So I'm going to ask you to please go ahead and close your eyes. And I'm going to be touching your face with either a sharp or a dull object. This is what dull is going to feel like. This is what sharp is gonna feel like, okay?
Okay.
Okay, now just go ahead and tell me what you feel.
Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull.
Okay, did that feel difficult at all?
Not really.
Okay, great. Okay, now just go ahead and relax your jaw for me. Just checking for some reflexes. Okay, I'm gonna be tapping on the jaw on this side. Does that hurt at all?
No.
Okay, that's all normal. So now I'm gonna go ahead and give you a patient account so you can change into that.
Okay.
And I'll be checking your abdomen, the back, and then we'll do the allergy test as well.
Okay.
Okay. Okay, I'm gonna be listening to the heart. Just gonna place this right here. You just breathe normally. Okay. Don't hear any murmurs. Everything sounds. I'm gonna listen to the lungs. Can you go ahead and give me a deep breath? Exhale. Inhale. Exhale. Place this right here. Inhale. Exhale. One more time. Exhale. Okay, I did hear a little bit of wheezing in the lungs, so that might just be from the allergic reaction. So I'm gonna be lifting up the gown a little bit. Okay, just taking a look at your belly. Just gonna cover the abdomen. Okay, notice a little bit of scar tissue. Have you had any surgeries in the past?
I did.
Okay, it looks like it was a while ago. The scars are completely healed. Do they ever cause you any pain?
Yes, not really.
No. Okay. How long ago?
About a couple months.
Okay.
Almost a year.
Okay. Okay. Okay, there's a little mole right here, a little bigger one. Have you ever noticed any changes to your mole?
Nothing.
No. Okay, that's great. I'm gonna be listening to your belly. Again, you can just breathe normally. Sounds pretty normal. Okay, just putting a tiny bit of pressure. If there's any discomfort, please let me know. Okay. Abdomen feels soft or no tender spots.
Maybe a little pressure right there.
A little pressure right here. Had you noticed that before?
Occasionally.
Okay. Just gonna be percussing, looking for normal sounds. Okay, the liver doesn't seem to be enlarged. Okay, seems normal. I'm just gonna check your feet and then I'm gonna ask you to turn around on your back. Okay, I'm just gonna be checking for any inflammation or signs of edema. There's no irritation. I don't really notice any redness or rashes. So that's great. Just gonna be palpating for any signs of edema. Looks normal. Okay, your pulses are symmetrical. And they're normal. Okay, I'm just gonna be testing your Babinski reflex. So I'm gonna be stroking the foot, looking for a normal neurological response. Okay, I'm gonna ask you to go ahead and flip over on your tummy. Just gonna be inspecting. I want to make sure there are no rashes on this part since we're gonna be doing the allergy test. Okay, everything looks normal. Okay, I'm gonna listen to the lungs right here on your back. Can you go ahead and give me a deep inhale? Exhale. One more time. Exhale. One more time. Exhale. One more time. Okay. That's completely normal. Okay, just gonna do a sensations test on the back. Make sure that your skin is not affected. Tell me if this feels sharp or dull.
That felt dull.
Okay. Tell me if that is sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp.
Okay. Back seems to be healthy, so I'm gonna be proceeding to do the allergy test. First, I'm just gonna mark the skin. We're gonna be testing for 6 allergens. Just gonna do 1, 2, 3. Just gonna be marking 1, 2, 3, 4, 5, 6 for the allergens that we're gonna be testing today. We're gonna be doing a patch test. That's number 1. Number 2. Number 3. Number 4. Five. And 6. Okay, I'm gonna be putting a protective film. Okay, we're gonna leave that for a few minutes, and then I'll be removing it and checking for any allergic reactions. Okay, it's gonna be removing the protective film so we can see the test results. Okay, so I definitely see a couple of reactions on your back. Gonna be taking a few measurements of them. Okay, so this one right here is 13 millimeters by 12. Number 4 we have 7 by 5. And number 6 is just 4 by 4. Okay. So number 2, number 4 definitely reactive. Number 6 will have to do additional testing. Okay, Matilda, I'm done with the allergy test, so now I'm going to ask you to go ahead and the results from the allergy test show that you are indeed allergic to cilantro. And the other one that you might be a little bit sensitive to is sesame.
Okay.
And there's one more that was a little bit reactive, but the test is inconclusive because the reaction was so small that we're going to have to do some blood tests to rule that one out. It might or it might not be. So that one's soy.
Okay.
Have you ever noticed any sensitivity to either soy or sesame?
No, I never noticed.
Okay. So we'll definitely do some blood tests just to confirm the results of this test, and then we'll figure out the next steps then.
Okay.
If this ever happens again, I would say if it's just minor symptoms like you had this time, just like a rash, no shortness of breath, you're feeling mostly okay, just a little bit like itchy or something, go ahead and take some Benadryl instead of ibuprofen. That's gonna really help with the symptoms.
Okay.
Okay, do you have any other questions for me at the moment? No. Okay, well, very good. I'll let you know as soon as I get the results back, and then we can discuss the next steps, okay?
Thank you very much.
It's very nice meeting you.
Very nice to meet you.
Bye.
Bye-bye.